As promised, Dr. Kevin Zorn is in studio with us to talk about Men's Health Awareness Month, which is November, which is winding down. Dr. Zorn is a urologist, but as a doctor would have a broader-based knowledge of medicine. And Mur and I were talking. First of all, welcome, Dr. Zorn. Thank you for coming in this morning.
Good morning. Thank you very much for having me.
Mur and I were talking about sleep deprivation as it's something that's very relevant to us. I've been getting up at 3:30 in the morning every week, except for when I've been on vacation, since 1985. And I was saying that there's a lot of guys who do what Mur and I do or there are, to put it another way, there are very, very few guys who do what we do over the long term who live to a ripe old age. Is that sleep deprivation, and what can you do to counter that?
Wow, that's a big one. Certainly, the recommended sleep for adults is between 7 to 9 hours of sleep.
Not even close, sir.
And likewise, I can concur. Residency, getting through medicine doesn't allow for
I'm
the
sure
most ideal dietary and sleep habits.
I'm sure.
So, there's certainly oodles of data that show or have correlates to sleep deprivation and mood, irritability,
Yep.
Weight gain. That's a big one where, you get into this metabolic syndrome where you start having lower testosterone, you get certain other metabolic changes, higher cholesterol. And with that, there's a whole circuit of increased chance of getting cardiovascular disease. So, is it the sleep deprivation directly, or does that start the cascade of breaking what we normally have, this rhythm? If it's called the circadian rhythm, our little pituitary releases certain hormones that, bring up growth hormone, increase testosterone that keeps our muscle mass and, other factors in play. And when we start losing that, I think that's where, that cycle with chronic sleep deprivation increases those chances of memory loss, obesity, even driving the car, accidents and so forth like that. So, there's no, unfortunately, there's no relationship of sleep deprivation and longevity in terms of living longer.
But the effects of sleep deprivation can take a toll.
Absolutely. And it's one of those slow kinks out of the armor. Slowly, it's a slow process, but I can't really say that everyone who sleeps doesn't sleep that many hours will not live a life expectancy, but it just puts those pegs in your jar of perhaps earlier death or other comorbidities that may lead to less survival.
Mur wanted to know about banking sleep. Is there any truth to that, or is that an old wives' tale?
Well, I think with sleep, it's not just sort of like, I plugged in 5 minutes here, 30 minutes there. Sleep itself is a period of 90-minute cycles. You go through like 3 phases of sleep with REM, deep sleep. So you got to get, a certain number of hours in that you get a certain number of cycles of sleep to benefit from, a proper rest. So it's one thing to take a power nap and say, well, I'll just clock 20 minutes here and I'll do another couple there. It's a combination thing. You really got to look at sleep as not just sort of a numbers game. I plug my car's outside. I want to charge it up. I need 2 hours. I can plug 5. Those are sort of equal minutes. Whereas sleep is it's a whole cycle of rest, and it's our body's way of healing itself, of repairing itself, and it takes that hours. So I don't really say that I would not suggest that banking 3 here, 1 there is going to be sufficient to say I've got my 7 hours of sleep.
Let's talk specifically about men's health. And for gentlemen of a certain age, and I would include myself in that category, is the prostate the overwhelming issue that affects men once they get past or to a certain age? Is that the one you got to watch out for the most?
It's the one that I think, to me, I'm biased, so yes.
Well, you're a urologist.
I'm a urologist.
So you deal with that,
And I started up a program called BPH Canada. So we have our website, bphcanada.com, which really covers a lot of what I'm going to talk about, which is one, if you're the age of 50 to 70, which is the window where, the recommendation of European, Canadian, American guidelines suggest prostate screening. And it's something so simple. It's a rectal exam, a digital feeling of the prostate. Could probably take about 15 seconds compared to what women have to go through. It's a piece of cake.
Right.
I think it was about a decade ago. Kat Spencer and we did something with a rectal exam on air.
Oh, you did one on the air.
On the air.
That's not happening today, by the way.
It's not. It's close on. But I think that's just the simplicity of it versus what women have to go for mammograms and so forth. The rectal exam is such a piece of cake, and unfortunately today with telemedicine, it's sort of we'll cut that out of the picture. So I think Some men are perhaps robbed from those digital rectal exams. Beyond the prostate, we can pick up, rectal pathologies, other, neurological conditions with a simple rectal exam. So with that and a simple blood test, it's called a PSA, prostate-specific antigen. It takes about 12 hours to get the results back. It's not something that is sent out to various difficult labs. It's something that's really easy. And the magic number is 4. So, there are some age differences, but PSA values of this protein in the blood should be less than 4 nanograms per milliliter. It's something that should be done once a year in those windows of ages. So prostate cancer is the big one. And the other one, which is even more common, is called BPH, which is BPH Canada, enlargement of the prostate. It's like prostate puberty. So you go through puberty in your 20s. Well, your prostate's going to start growing in 50s and 60s and manifest it by symptoms of decreased urinary stream, waking up more at nighttime, which ties into the nocturia and sleep deprivation. Enter those patients into my office because that's really the biggest quality of life impact. And with it, risk of infection. And fortunately, some men wait till the very end until they block off. And then they have those, Hiroshima moments where life changes and they're getting a catheter
I'm
put in.
I'm going to faint.
Well, this is my life. And I see this. And I like to get patients in earlier. We can have that discussion of, hey, I can start them on meds. We can shrink the prostate. We can inject steam in the prostate. There's new stents coming out, kind of like, for your heart. If you're blocked in the heart, well, you don't have to crack the chest anymore. You go in and you put in these small stents and off you go. We have those for the prostate as well.
What are some preventive lifestyle measures?
Well, certainly there is correlates with LUTS, lower urinary tract symptom progression for men with what's called metabolic syndrome. So, just like the wise words of Mark Moyat, he's an MD, PhD at University of Michigan, diet, exercise have been well correlated with reduction risks of progression of BPH. It increases your testosterone, helps you sleep better. So, I think the old adage, I have a comic on my, when you enter my office, and on the left, there's a surgery pills, and everyone's lined up for there, but the lifestyle modifications, no one really wants to do that. I think that's the key thing. If you can change those little habits of trying to get a little bit more sleep, eating better, exercising, the cardiovascular health is really, I think, the one area that with our busy lifestyles, we kind of push off to a later date. And that's really the big implementation I think can make men live longer.
Well, that's one of the advantages of my work hours. I got to get up in the middle of the night, but I have the whole day, so I can go to the pool, and I swim 3 times a week, and I think that helps me a lot. And I've also changed my diet in the last few years, and that has helped a lot. I've dropped some weight. Those are difference makers. In terms of the digital test and the blood test, how often, interval-wise, do you suggest?
So the textbook answer is once a year. It's something that you ought to be going once a year for your, cholesterol, know your numbers, right? I mean, you can do exercise, you can have your diet, and again, some of the wise words, you can pick whatever diet you want, but do what needs to be done to move those numbers. What's your HDL? What's your cholesterol at? What is your testosterone at? What's your PSA at? So those should be done once a year. When the PSA is excessively low, less than 1, the Canadian guidelines suggest we can do it every 2 or 4 years. But try to remember to go to a doctor every 4 years is a nice thing to put on an algorithm sheet. But truthfully said, I think that to do once a year is sufficient.
It behooves me to ask you, because it's something that men don't want to talk about erectile dysfunction. Where are we with that besides the pill?
Oh man, I'm so glad you brought this up, because I look at every year, every man at some point will start having some difficulty achieving or maintaining an erection. And I think that's just related to, be it neurological or most common vascular. So are you a smoker? Are you diabetic? Do you have high cholesterol? And again, erectile dysfunction can sometimes precede a coronary artery event, a MACE, major or coronary artery event, by 5 or 7 years.
Because it's a blood flow issue.
Correct. So if the microvasculature isn't at its best, well, what about the macrovascular? So if you start having some early age ED, aside from coming in and let's talk about Viagra, Cialis, Levitra, or talk about the various other medications we have to help with improving erections, and something as silly sometimes as giving a statin to lower cholesterol has also been correlated to improve erectile flow, sort of like unclogging the vessels. So we have other, shockwave, there's testosterone supplementation. We have injectables, so certain patients who've had prostate cancer, where they have had treatments where they've injured the nerves to go to the vessels to, say, open up and create an erection. Well, we have other bypasses and, even cheaper than those medications, a small injection. and you can be in the middle of a church, or you can be in the middle of a shopping mall. Within 10 minutes of that small injections, you achieve a strong erection.
Just like the old days of grade 8, going up to the chalkboard and going, "Oh no."
So, but nonetheless, there are a lot of new treatments we have, and I think the key thing here is, identifying and not being shy to have that discussion with your doctor. I think sometimes people are shy and a bit anxious to bring it up, but not only is it something to help in terms of your male health, male sexual health, but also in terms of your whole cardiovascular conditioning. So the questions then to be asked, aside from do I go get some pills and do I get evaluated with my testosterone, is do I, am I exercising? Am I doing the things I need to be doing for my overall cardiovascular health?
Dr. Zorn, where can people find you online if they want to know more?
Sure. Simple, bphcanada.com. It's available in 10 languages too now. And it really has all the information for contacting us for consultation, situated just off the carry near the Orange Julep.
Dr. Kevin Zorn in to talk to us this morning as Men's Health Awareness Month winds down. Dr. Zorn, thank you so much.
Thank you.